This segment sponsored by the Nashville Pet Emergency Clinic.
Humans aren't the only ones spreading the flu. It appears that dogs are too. Veterinarian Craig Pryor is here now with some tips on how to know how to keep your pet safe. Yes. Dogs and cats can get the flu, right?
So dog flu, there's actually two different strains, one crossed from horses, one crossed from birds. And they can be contracted by cats as well. It's not, the dog flu is not contagious to humans, so you're safe.
And vice versa?
And vice versa, no.
Okay.
So, but the thing is with dog flu, the human flu can actually mutate fairly fast. That's what they found with this year, with why vaccines aren't quite as effective as they'd like. Dog flu is pretty stable. So there's two main strains that are around, and it's a respiratory virus. So the clinical signs in dogs: coughing, sneezing, runny nose, runny eyes, and very sick. And the bad thing about it is it can actually move down in their lungs and cause a severe pneumonia, especially when they get secondary infections. So it's highly contagious. And so, you know, any dogs that go to dog parks, grooming, you know,
doggy
daycare, anywhere dogs interact, could actually come in contact with it, because you can have dogs that are carriers that don't show clinical signs. So your dog could actually be around a dog that looks healthy, and they can, you know, doggy kisses, lick each other, or they share a toy, well, they can contract it that way.
Wow.
And there's been outbreaks in nearly every state in the union now. And so it's about 80 to 90% of dogs that come in contact with it will come down with it. It tends to be, a lot of people think about kennel cough being, oh, my dog's got kennel cough. Well, this kennel cough has bunches of different strains. It's just a misnomer, sort of a catch-all expression. And kennel cough could actually be dog flu that your dog's coming down with. And, you know, about 20% of the dogs will get the really severe form, which is pneumonia, which can, you know, there's low mortality. But about 1 to 8% of dogs may die from it, especially if they're puppies or older dogs.
So how do you treat it? So
treatment is just like ours. It's symptomatic and supportive. So you just got to keep them eating. Some dogs need to be on IV fluids. If they develop a pneumonia, they need to be on antibiotics if they've got secondary infections, things like this. And it's just, you know, symptomatic supportive treatment. But when you see outbreaks, it's devastating because all these dogs get it. And it's just so, you know, it's just, they're all just coming in super, super sick. And the thing is, if you've got a dog that's had dog flu or contracted dog flu, they're contagious for up to 21 days.
Oh my.
So you really don't want to take them out of the house. You don't want to take them around other dogs, because you're just going to spread it. The good
and there
news,
is a vaccine,
though,
right?
The good news is the vaccines are very, very effective. Now, no vaccine's 100% effective, but it's like it's a lot more effective than the human flu vaccine. So there's a vaccine that actually has both strains in it. Moo has had hers. So it's an initial vaccine. It's a booster 3 weeks later. And so if there's an outbreak and you run in and go, I got to get my dog vaccinated because it hasn't had any, well, if your dog's been exposed to it, it's too late. The vaccine is to prevent it. It can't be used after the fact. So it's initial vaccine 3 weeks later, and then yearly. And Moo, because she goes so many places and she travels so much with me, we don't know where we're going to be in contact with this. And, you know, you think about, you know, there hasn't been severe outbreaks in Tennessee, but, you know, if you're traveling somewhere, you take your dog to Florida, you know, there's routinely bad outbreaks in Florida. And there'll eventually be a bad outbreak here at some point. We just don't know when. So best to vaccinate than wait. So if your dog's going to be in contact with other dogs, you go regularly to the dog park, you go regularly to daycare, you go regularly to groom or board, your dog needs to be vaccinated.
All right. Is there a vaccine for cats as well?
No, there's not at this point.
Okay. Moo, I think, is over this topic. She's kind of yawning now.
Yeah, she's saying, come on, time to
come
pat.
on, Dad.
Time to pat.
It's time to go play.
Yeah, time to pat me. Okay, you want this hand?
Tell me about her harness.
So this harness is just, you know, she's a puller. So most dogs, you want to walk nicely by your side, but when they get excited, they don't. They tend to run out front, and then they're pulling on their lead and they're choking all the time. The harness prevents that. Okay. It gives better control, and it doesn't put any pressure on her neck, and so she's not choking or anything like that. It's just a nicer way for her to walk.
Makes a lot of sense.
Yes, it does.
Moo, glad you were here.
She likes being here, don't you, huh, baby?
Dr. Pryor, thanks so much.
Our
Appreciate
pleasure.
you being with us, as always. You can go to newschannel5.com if you'd like information for the Murphy Road Animal Hospital or the various Nashville pet emergency locations near you.